Press your thumb into your shin right now. Hold it for 5 seconds. Let go. If there's a dent left behind that doesn't bounce back, your body might be quietly holding onto fluid it shouldn't be. And one of the most common reasons is your kidneys. Quick reset before we dive in. You've got two kidneys, roughly fist-sized, tucked under your rib cage on either side of your spine. Everyone knows the headline job: filtering waste out of your blood. Fewer people know they're also running your electrolyte balance, controlling blood acidity, managing bone density, and signaling your bone marrow to produce red blood cells. When that system breaks down, it doesn't just affect urine, it ripples through nearly every organ you have. Let's get into it. Here's the unsettling part. Roughly 9 out of 10 people walking around with chronic kidney disease have no idea it's there. Not because the disease is rare, it affects more than a tenth of the world's population, but because it's a master of disguise. It shows up in your nails, your skin, your sleep, even your breath, long before it shows up on a symptom checklist. I'm a physician, and today I'm walking you through the signs your kidneys give off when they're struggling, starting with the one most people would never connect to their kidneys at all. Sign 1. The itch that won't quit. We're starting with one most people brush off completely: a deep, whole-body itch that's worse at night and doesn't respond to lotion. I once had a patient, a retired mechanic in his early 60s, come in because he'd scratched a patch on his forearm raw enough to scar. He assumed it was dry skin from winter weather. His blood work told a different story: kidney function down to a fraction of normal. Here's the mechanism. As kidneys lose filtering capacity, toxins that should be cleared build up in the bloodstream, a state called uremia. These toxins irritate nerve endings directly and also activate a specific itch receptor, PAR2, in the skin. Left long enough, they can even reach the brain and keep itch circuits switched on permanently. It's one of the cruelest early signals because it's so easy to blame on something else: dry air, allergies, a new detergent. Sign 2. Nails with two distinct colors. Go look at your thumbnail. See that pale crescent near the cuticle? Totally normal. That's the lunula, essentially the growth zone of the nail. Now compare that to something different: nails where roughly the bottom half is chalky white and the top half is a dull pink-brown, with a sharp line between the two. Not a gradient, a clean border. This pattern is called Lindsay's nails, or half and half nails, and it shows up in roughly a fifth to half of people with chronic kidney disease, and in closer to 40% of those with advanced kidney failure. For a while, doctors weren't sure why this happened. The current explanation involves two separate effects. The pale band is linked to changes in tiny blood vessels under the nail bed caused by chronic anemia, while the discolored band comes from melanin deposits, possibly triggered by elevated levels of a pigment-stimulating hormone in uremia. It's not a guaranteed diagnosis on its own. It can show up in other illnesses too, but paired with other signs on this list, it's a meaningful clue. Sign 3. A layer of foam on your urine. Not a couple of bubbles that pop in a few seconds. A genuine dense foam cap that lingers, similar to foam on a poured beer. To understand why this happens, picture the filtering units inside your kidneys, called glomeruli. Each kidney has roughly 1 million of them. Each one is a tiny tangle of blood vessels so narrow that blood cells pass through single file. Wrapped around these vessels are specialized cells with finger-like projections that interlock to form a microscopic sieve. When kidney tissue is damaged, those projections flatten and the sieve develops gaps large enough for a blood protein called albumin to slip through into the urine. Albumin happens to have a chemical structure similar to soap, which is exactly why even small amounts create that persistent foam. It's a simple visual tell for a problem: protein leakage, that would otherwise require a lab test to catch. Sign 4. Swelling that leaves a dent. This connects directly to the last sign. Remember the shin test from the hook? Let's revisit it now that you know why it matters. When you're losing albumin through your urine, your blood ends up with less of it. And albumin's job is to keep fluid trapped inside your blood vessels through osmotic pressure. Less albumin means fluid seeps out into surrounding tissue instead, and gravity pulls it downward, which is why ankles and shins swell first. It can also pool in looser tissue, like around the eyes. Here's the cruel irony. Even though fluid is building up in your tissues, Your blood vessels register less circulating volume, so your kidneys interpret that as dehydration and respond by retaining even more salt and water. That's the feedback loop that turns mild swelling into significant swelling. In severe cases, that excess fluid can back up into the lungs and cause shortness of breath. Sign 5. Getting up to pee multiple times a night. Common misconception. Peeing frequently means your kidneys are working great. Actually, the opposite can be true. What matters is concentration, not volume. One of the earliest functions to decline in kidney disease is the ability to concentrate urine overnight. Normally, a hormone called ADH helps your kidneys produce less, more concentrated urine while you sleep, so you're not waking up every 2 hours. When that concentrating ability breaks down, you'll find yourself making repeated trips to the bathroom at night, a pattern called nocturia, and one of the more easily noticed early red flags. Sign 6. An unexplained metallic taste. If food has started tasting faintly metallic, like sucking on a coin, pay attention. Here's why. As urea accumulates in the blood, some diffuses into saliva, where ordinary oral bacteria convert it into ammonia and related compounds. Those byproducts interact with taste receptors on the tongue in a way that most people describe as metallic. The same compounds can also make your breath carry a faint urine-like odor, sometimes called uremic fetor. Between the taste and the smell, it's no wonder appetite tends to drop alongside it. Sign 7. Nausea, vomiting, and unexplained weight loss. This one gets more dramatic than people expect. There's a region of your brainstem called the chemoreceptor trigger zone, and it's unusual in that it sits outside the blood-brain barrier, meaning it can sample your blood directly for toxins. Its job is to detect things like food poisoning and trigger vomiting before those toxins do real damage. The problem is, it can't tell the difference between food poisoning and uremic toxins from kidney failure. So it triggers the exact same response: appetite suppression, nausea, and vomiting. Over weeks or months, that adds up to noticeable unintentional weight loss, often one of the more alarming signs that finally pushes someone to see a doctor. Sign 8. Bruising you can't explain. Most people bump into furniture occasionally and barely notice a mark the next day. In advanced kidney disease, the same minor bump can leave a large, deep bruise, sometimes without the person even remembering the impact. Normally, platelets, tiny cell fragments in your blood, rush to a site of injury and clump together to seal it, like a natural patch. Uremic toxins interfere with that clumping process, making platelets less effective even when their numbers are normal. Watch for a cluster of related signs: gums bleeding more than usual when brushing, more frequent nosebleeds, or bruises appearing without a clear cause. Sign 9. Muscle cramps, especially at night. To explain this one, we need to talk about phosphate, a mineral your body usually regulates tightly. Most people consume more phosphate than they need from food, and healthy kidneys clear the excess without issue. Damaged kidneys can't keep pace, so phosphate accumulates in the blood. Your body fights back with a hormone called FGF23, which forces the kidneys to dump more phosphate into urine and also blocks the intestine from absorbing as much calcium. Over time, that defense mechanism can drop your blood calcium levels. And low calcium is a well-known trigger for sudden, painful muscle cramps, often striking right as you're trying to fall asleep. Calcium isn't the only culprit either. Early kidney disease can also cause low magnesium or excess acid in the blood, both of which can produce the same cramping. If you're getting cramps with no new exercise routine to explain them, it's worth having your kidney function and electrolytes checked. Sign 10. Losing height or breaking bones easily. This is the next domino after sign 9. When blood calcium drops, your body releases parathyroid hormone, which pulls calcium out of storage, meaning your bones, to keep blood levels stable. It's an effective short-term fix and a long-term problem. Bones gradually lose density and become prone to fracture, a condition called renal osteodystrophy, a kidney-driven form of osteoporosis. One subtle clue I always ask about: have you gotten noticeably shorter over the years? A few inches of height loss can reflect compression in the spine from weakened bone. The more obvious version is fracturing a wrist, hip, or vertebra from a fall that shouldn't have caused a break at all. Sign 11. Calcium deposits under the skin. Prick. When phosphate stays elevated, it binds with calcium to form solid calcium phosphate crystals, and these crystals can deposit in unexpected places. Under the skin, this shows up as firm, painless whitish yellow nodules, a condition called calcinosis cutis. Occasionally, they rupture and release a thick, paste-like material. This isn't exclusive to kidney disease. Autoimmune conditions like scleroderma can cause the same thing. But in kidney patients, it's a visible marker of how far phosphate levels have drifted from normality. Sign 12. Arteries you can see on an X-ray. Normally, you shouldn't be able to make out artery outlines clearly on a standard X-ray. Soft tissue doesn't show up with that kind of contrast. When you can see them sharply defined, that's usually calcium deposition in the vessel wall itself. Here's what's happening. The smooth muscle cells that make up artery walls are designed to expand and contract to manage blood flow. When chronically exposed to high phosphate levels, those cells essentially transform. They start behaving like bone-forming cells and begin laying down calcium deposits inside the vessel wall. The artery, which should be flexible, turns rigid. In some patients, you can actually feel this under the skin in a peripheral vessel. It has a firm, cord-like quality, almost like a tensioned wire. Sign 13. An overwhelming urge to move your legs at night. Restless leg syndrome is exactly what it sounds like. An irresistible urge to move your legs. Worst when you're lying still trying to sleep. The connection to kidney health runs through a hormone called hepcidin. Hepcidin's normal job is protective. During an infection, it locks iron away in storage and blocks new iron absorption from food, starving bacteria that need iron to multiply, while your immune system handles the rest. The problem is that chronic inflammation from uremic toxin buildup keeps hepcidin elevated even without an active infection. And kidneys that aren't functioning well also clear hepcidin from the blood more slowly, compounding the effect. The result is a body that's functionally iron deficient at the brain level, even if standard blood iron markers look normal. Since the brain needs iron to produce dopamine, and dopamine helps regulate the urge to move, that deficiency is believed to be a major driver of restless leg syndrome in kidney disease. Sign 14. Chest pain that worsens with every heartbeat. Uremic toxins can inflame the pericardium, the thin membrane surrounding the heart, a condition called uremic pericarditis. Unlike an inflamed joint, you can't rest the heart. It keeps beating, and every beat causes the inflamed surfaces to rub against each other, producing real pain. With a stethoscope, this creates a distinctive, coarse, scratching sound as the heart moves, a finding doctors can sometimes pick up before imaging confirms it. It's considered a later stage complication and a signal that uremia has progressed significantly. Kidneys do an enormous amount of invisible work, and when they start to struggle, the signs are often hiding in places you wouldn't think to look. Your nails, your skin, your sleep, even your breath. If this helped you understand your own body a little better, the next video I'd recommend is on natural strategies for lowering blood pressure, since that's one of the most effective things you can do to protect your kidneys long term. Stay curious, stay healthy, and I'll see you in the next one. If your kidneys taught you something today, subscribe. There's a lot more your body's been trying to tell you.